of 10 years of work. We've had this legislation up here for a long time. We've spent a long time trying to be sure that we get it exactly right, that we have the medical issues covered that we need to cover. We firmly believe that medical marijuana should be allowed to help people that we know it can help. There have been thousands of studies that prove that medical marijuana can help people. That can help people. Medical marijuana is supported by the National Cancer Institute, Alcohol and Drug Centers, HIV/AIDS groups, Nashville Cares, the VA Hospital, the Tennessee Sheriffs are not against it. The World Health Organization, National Nurses Association, American Academy of Family Physicians, American Public Health Association, American Medical Association, American College of Physicians. There has never been a study to deem marijuana illegal. There's never been one. One day somebody decided to touch it and say illegal, and it suddenly was illegal. But there are no studies that prove that marijuana has any detrimental effects on anybody. What has detrimental effects on people is alcohol and man-made drugs. Those are the things that make people go crazy, that make them get in their car and think that they're not drunk and drive, that make them shoot, kill, and rob other people. Medical marijuana has been used for thousands of years by a lot of different countries. It was legal in Tennessee in the mid-'80s. The U.S. government has a patent on medical marijuana. It's been proven that medical marijuana positively affects patients with cancer, HIV, Hep C, glaucoma, Alzheimer's, PTSD, wasting syndrome from cancer, severe, debilitating, and chronic pain. It's good for people who are in hospice. And for me personally, my brother who died 4 years ago with Crohn's disease had asked me if it was available because he wanted to use it. He died a terrible death for lack of a plant that has never been proven to have any negative aspects to it at all, that has never, ever had a study done to prove it illegal. Now, I know that there is another piece of legislation coming up, and that is a medical marijuana bill, too, that it's my understanding that the sponsors have taken parts of my legislation to create their legislation. The same thing happened with the cannabis oil that we're moving to.
Representative Jones, let's just stick to your bill and
I'm trying
the
to,
substantive
Mr. Chairman.
portions of your bill, and let's not talk about other people's bills and make idle accusations.
There are no accusations.
Okay.
I'm trying to explain where we are.
Okay. Fair
enough. Anyway, that bill is part of all of the work that we've put in here. So it seems to me, since medical marijuana has never, ever been placed in criminal justice because it is a health issue, that it would be only fair that this legislation go through the same process as the other legislation that's coming up here on the same issue.
Leader Stewart, you're recognized.
Just one question, because I've heard that, and I guess, Chairman, you'll talk about the proper path for or our ability to move bills from one committee to another. But I will say, Representative Jones, you've been talking to me about this bill for at least 3 years, and I do think that your work on this bill, one thing it's done, it's really changed in large part the way Tennesseans view this issue. Obviously, there are a lot of factors, but, I mean, you've been pushing this. And it's funny, I noticed in an MTSU poll recently, 75% of Tennesseans support the policy underlying this bill. And so, first of all, just thank you for your work on this, because I think, when you started this, you were a lonely voice, and I think the people are now with you. I look forward to voting on this bill today. I think it's going to be a chance for our committee to weigh in. Obviously, I understand, there may be other legislation out there, but this is the bill that we've got before us. I think it's a good policy. I think the detail in the bill shows the work you put into it. And again, I think Tennesseans are waiting for us to pass this bill out. So I look forward to voting for it. And I salute you for your long journey in getting this before us.
And I guess, Representative Stewart, Leader Stewart, you had inferred that I would lay out the path of this bill if it was to pass this committee. If it was to pass today, it would go to criminal full, then to be referred to full health committee, and then it'd go to government operations. So that would be the path of this bill today if it was to make it out of this committee.
And thank you, Mr. Chairman.
Okay. Representative Lamberth, or Chairman Lamberth, excuse me. You're recognized.
Thank you, Chairman. And Representative, I want to thank you for what is obviously an enormous amount of work that you put into this bill. And I understand your frustrations that there may be other bills that are out there that aren't in this committee, when my hope would be that all bills within a certain subject matter, if they deal with criminal law, would go through criminal justice. So I understand the frustration, but just in talking about this bill, I mean, this is a massive piece of legislation, and even you will recognize, because you've worked so hard on it, that it is a huge, huge issue for our state. Do you have, I mean, you mentioned several doctors, you mentioned several studies. I've tried very hard over the past several months and even the last couple of years to try to educate myself on what is fact, what is myth, what is rumor, and what is actual science. And sometimes those are hard, and you're nodding your head, those are kind of hard to separate and figure out which is just an online rumor and which is an actual study. Do you have anyone here that is a doctor or a scientist?
Mm-mm.
Okay. Well, I was hoping that we might be able to lead off with that, but if there's no one here to...
Well, I was going to say that Bernie Ellis usually comes and testifies on this legislation. He was a member of the CDC and did a lot of these studies, and he has helped us. Without his help, we wouldn't have this very, very conservative, tightly drawn, overseen piece of legislation.
Okay, and I know you mentioned several other groups, for instance, the Sheriff's Department, TBI. I do see some of those folks here.
National.
Okay, so when you mentioned earlier that those groups were in support of this bill, you didn't necessarily mean our folks are in Tennessee.
I didn't.
Because they were all looking at each other back there while you were saying that, kind of mystified as to why they were being quoted in favor of it.
No, I didn't quote them in favor of it. If anybody listening would have seen that it was national sheriffs, that the national.
Okay, well, and
people.
we may hear from those folks in a few minutes. Again, I really appreciate your hard work on this. I know this is a very personal and passionate issue for you, and I mean it's a dense bill. It's a lot to talk about, so I'm sure we'll do some more of that.
And like I said, we've been working on this legislation for a long, long time, and we know that we're going to make $10 million the first year. After that, we'll probably make $33 million, and it just goes up from there, which can help with our revenue that we're having such trouble with now, because these folks need marijuana. They need the medical part of marijuana. These people sitting over here in the corner have been up here with me for years supporting this and trying to get help for themselves and for their son. So it's an extremely important issue for many people for
Okay.
many people in this state. And like Representative Stewart said, the polls are at 75% that people favor medical marijuana. And it just seems like that this plant has not had a single study that would make anybody think that there was anything wrong with it. Just one day, somebody turned around and said, we can't produce enough to help with the HIV AIDS, so we're just going to make it illegal. And then it was illegal.
Okay, and I understand it polls high, but we do represent the voices of our constituents from each and every one districts. So just keep that in mind. Now, Representative Goins, did you have a question? I had you on the list.
A few comments, if it's appropriate, Chairman. Thank you, and thank you, Representative Jones. And I actually think that you would find that under the right circumstances, this would be a friendly committee to what you're trying to get to here.
How can I get to the right circumstances? That would be my question.
My concerns are that this is a very big step for this state. I mean, we could talk about polling. We can talk about what the national data shows. We could talk about what other states are doing or what other countries are doing or what the World Health Organization is doing. But we haven't talked about that here. We haven't had an opportunity to discuss whether or not coming through the criminal justice that the actual coding is right, that the actual process is proper to move forward. And that's where I have anxieties. I know that some would prescribe something for my anxieties, but
medical marijuana.
But that's not legal yet. What's given me heartburn, Representative Jones, is that we don't have testimonials here. We can't go back to our districts after making, if that were the will of the body, making a huge step for Tennessee and say, we have exhausted hours of homework on this thing. Yeah, I've gotten emails and I've seen data and I've even done some research on my own, but not a soul has walked in my office and said, I'm a professional, this is my background, and this is what I'm doing. And that's the kind of homework that needs to be done to make me feel comfortable going back to Morristown, Tennessee, saying, this is why I voted the way I voted. And so with that explanation, Representative Jones, I'd like to make a motion at this time that we send this to summer study. But before I get a second, I want a commitment of a true summer study. I want to be able to go to my constituents, whether I end up voting for something like this or against something like this next year, which I'm okay doing. I want to be able to go back to my constituents and explain my vote knowledgeably and without anyone having the benefit of the doubt that I sat through as much testimonial as possible and exhausted as much time as I could withstand on the subject.
There's a second? Okay, I've got a motion and a second to send this bill to summer study. Those in favor of sending House Bill 561 to summer study say aye. Aye. Opposed, nay? No. Ayes have it.
Members, thank you.